Hi and welcome to Getting to Know Your Baby. So this is a fairly simple, quick tutorial just to look at some of the baby reflexes and your baby's cues and how to recognise them and help for you to make better decisions around feeding and sleep. So my name is Trish Martin. So my business is babycoach.co.nz. I'm a mum of three. I was born in Holland. I've been here for 38 years, so you can pretty much call me a Kiwi. I love outdoor adventuring and animals as well. So my professional background is actually registered nursing. So I've been a registered nurse as well as a plunket nurse in both the public and the private arena. I'm also a personal fitness trainer and I love holistic health therapies. And the bottom one, I'm a huge mum's advocate. So it's really, really important for you to trust your intuition because that often gets in the way of decision making. So my why, absolutely mums are important, and I think they are actually the most important. So happy mum, happy baby is my motto. We get a lot of information from family, from friends, from the internet, from books and magazines, which can often lead us into overwhelm and which doesn't create much confidence when we actually start to second guess ourselves. So it's really, really important to actually filter that information and trust what's actually going to work for you, because what's going to work for you might not actually work for another mum. So we all need to take all the information and actually filter it and make sure that it's going to work for us. So for knowledge is power, and that's what this little tutorial is today, is actually just giving you some knowledge as far as your baby's reflexes, how to recognize them, and also your baby's cues. So you are important, and definitely so is your sleep. Sleep improves memory, creates more awareness and understanding, improves learning, less irritability, oxytocin, which we'll actually talk a little bit more about in another tutorial as far as for feeding, builds positive relationships, so it helps that bonding process with your baby and also creates self-confidence. It's also important to look after our physical health. Cell regeneration, when we sometimes sleep, we actually regenerate ourselves, but also it actually helps when we keep physically fit. Improves circulation, helps body function, and gives you more energy. It actually stops you being a little bit cranky, especially when you actually go outside and get some vitamin D and some fresh air, even in the winter time. So topics we are going to be discussing are your baby's reflexes, baby's cues and how to recognise them, and also settling and sleep, just to touch on a little bit, just to help you recognise some of the things in regards to your baby's reflexes and baby's cues. So first, let's look at the word involuntary. So an action that you can't control or do subconsciously without realising you're actually doing it. Now, your baby has actually have three main involuntary reflexes: the sucking reflex, the rooting reflex, and also the startle reflex. The two reflexes that we'll actually be discussing in this simple tutorial is the sucking reflex and the rooting reflex. The startle reflex is very common, and a lot of babies have it up to the age of 8 to 12 weeks. It's actually a very natural reflex, but it's more so to do with a lot of settling and sleep. So today we're going to be looking at the sucking reflex and the rooting reflex. So let's look at the sucking reflex. Again, it's an involuntary reflex. This reflex is actually develops at 32 weeks of age. So some of you actually may have seen when you've had scans later on in your pregnancies that your baby's already sucking their fingers or their thumbs. And that is because this reflex is actually very, very prominent from 32 weeks of age, and they know exactly how to suck. It helps them feed. It also helps them for comfort. It helps them settle as far as settling to sleep. And it's also a developmental reflex because as they grow older and they're looking at food, sucking their thumbs, like a little bit older as well, and helping swallow and things like that as far as solids. It is actually initiated by touch. So it's touch on the top of the palate and the tongue. So that can be by the nipple, can be by a bottle of teat, dummies, or even finger, or even by their own actual hands when they're actually sucking their hands. It's also initiated by that. So the challenge is that the sucking reflex is always present. whether your baby is actually hungry or not. So the common challenges for mums when it comes to sucking reflex is if your baby is actually feeding for a very, very long time. So it's important to actually recognise the good feeding swallows and feeding sucks to the actual comfort sucks. So when your baby is particularly breastfeeding, a lot of babies actually take the amount of milk they need in the first 10 or 15 minutes, depending on your lactation. Some babies can be on for 40 minutes or over. So when I'm hearing some mums actually saying that my baby is feeding a lot and they are feeding every hour and they seem to be on for 40 minutes, it is probably most likely that you are unable to recognise that your baby is full because they will continue to suck even for comfort. Baby sucking on their hands can be mistaken for hunger too. Babies love finding their hands and finding sucking on their skin to skin contact, and they will do this quite frequently, especially as they grow at 6 weeks to 8 weeks to 12 weeks of age. Sucking sounds can even be heard while they are asleep, and this can also be mistaken for hunger. So let's look at the rooting reflex. So the rooting reflex is also an involuntary reflex. So the rooting reflex is there to help them find the nipple, especially when they are newborns. So it helps them feed. It's also there when they're being cuddled, especially cradled in the mum's arms or in somebody else's arms, and sometimes even when you're burping. So the rooting reflex is actually initiated by touching the cheeks and the lips. So baby will actually turn the head towards the side of the cheek that is touched. So especially when you are burping your baby on your shoulder and their cheek is actually touching your cheek, they will actually root to the side that the stimulus is on. Even when you're holding your baby in your arms and they've actually really hit a full tummy, they have fallen asleep, but while they're in their arms, they're actually woken up and they can feel your forearm or your arms or your chest, even some clothing touching their cheek. They will actually turn their head and open their mouth to look for food. The challenge again with this reflex, just like the sucking reflex, is it's always present whether your baby is hungry or not. So it's really important to recognize how your baby is feeding, how long they're feeding for, and recognizing what type of sucking they are doing, because different sucks for hunger and for filling their tummy and different sucks for snacking and comfort. So the rooting reflex is present when your baby isn't hungry. You can be burping your baby over your shoulders and they could be rooting. Cradling your baby in your arms and cheeks are stimulated by touch from your arms and chest. Your baby's own hands while trying to find them, and material even such as blankets and muslins. So what else do I need to know? So let's look at your baby's cues. So these are really, really important, and I would say majority of mums don't know how to recognise their baby's cues, and to be fair, they're often not actually spoken about. So your baby's cues for hunger, tiredness, pain and wind are all exactly the same. Yep, 100% exactly the same, and that's why they can be so confusing. So what are the signs? So these signs are your baby's grizzly, jerky movements of the arms and legs, lots of crying, arching of the back, blank stare, especially for those babies 4 weeks and over, and especially for babies 6 weeks to 12 weeks, rubbing of the eyes and scratching their head. So these signs are all exactly the same for both hunger, for tiredness, for wind, and for pain. So how and when to best recognise these signs? So it is really hard to recognise these signs when your baby is fast asleep. So that's where often the challenge lies, is when your baby's actually been feeding and they've actually fallen asleep in your arms, and then you actually try and place them in the bassinet fast asleep. But you actually don't know whether they're tired or whether they still have wind or whether they still may be hungry. So the best time to actually recognise these signs are when your baby is awake, not asleep. On a mat after feeding or nappy change, and after a baby has been relaxed. So especially mat time is really, really important for you to recognise your baby signs, because they enjoy being on the mat, recognising spatial awareness, just being on their own for just a few minutes while you actually go and grab yourself a cup of tea or some breakfast if it's in the morning time. So typical signs as far as your baby's being nice and relaxed on the mat, once they start to actually grizzle and they start to have jerky movements and they start to arch their back, you can pretty much guarantee that if they've had a really, really good feed and they've been awake for a certain amount of time, that it's now sleep time. So it's important for you to recognize and trust your intuition and know the difference. So what gets in the way of trusting your intuition, right, is information overwhelm. So that's particularly from friends, from family, from the internet, where often as mums Googling lots of things as far as on the internet. It could also be books and it could also be magazines, which leads to a lot of confusion. And if you are starting to get confused and you're starting to get anxious, you start to second guess yourself and not trusting your thoughts. And that's when a whole lot of things can actually start to happen. So what I want you guys to use is a STOP acronym. So this is actually really, really easy, and it allows you to actually give you some time to think ahead. So S is for stop or slow down, T is for thinking, right? O is for observe, and P is for plan. So just let me give you a scenario as far as you've just been feeding baby's actually fallen asleep. So your best bet is actually put your baby on the mat, change their nappy so that they will actually wake up a little bit, but they're nice and relaxed. So what you're then looking for is some tired signs. So your baby's starting to show some tired signs after a few minutes. So they're grizzling, they're crying, they're doing lots of jerky movements, they're arching the back. And you start to think, well, what now? And sometimes what actually happens, because a lot of the information that you may have been told is that, when baby shows these kind of signs, they're probably still hungry. And so what you actually may do is you place baby back on the boob, which can lead to more challenges as far as when your baby's actually been full and they've got a full tummy, then you're adding milk because of that sucking reflex. They're still feeding, so you're adding more and more milk to an already over full tummy, and that tummy may start to get a little bit more wind, may actually start to feel a little bit more bloated and painful. So it's really important to make sure that you use this acronym to actually help you make better decisions. So stop and slow down. Think of how your baby's actually been feeding, how long your baby's been feeding for, did they fall asleep on the breast, how long they've actually been awake for. So you're allowing yourself to think of what has actually happened before your baby started to grizzle and your baby started to cry. You're then observing your baby, again recognizing those baby cues, and you start to plan. So you know that your baby's actually had a really good feed, it's been on the mat, and they've had a really awesome little playtime, even if it's only for 1 or 2 minutes. They've been nice and relaxed. They've got a dry nappy. They've actually burped. So these signs must be tired signs. And so then you would actually either swaddle, put your baby in a sleeping bag, and place them into bed. So here is a scenario. Your baby has just finished feeding. They may have fallen asleep or is awake and relaxed. You burp your baby, change their nappy and place them on the mat for some quiet time. While your baby remains relaxed on the mat for a few minutes, they start to show signs: grizzling, jerky movements, arching of the back. This is your cue to recognize it's time for bed. Another scenario, you're feeding your baby is feeding well but has been over for 40 minutes, falling asleep on the breast or bottle. You're not sure if they are still hungry. You burp them, but they are consistently rooting at your cheek while trying to burp, grizzling and arching their back and pulling up their knees. You try to refeed. They suck for a few minutes but become grizzly again. You're not sure what to do, and this is a typical scenario. They are most likely tired and not hungry, or probably don't even have any wind because you've already burped your baby. So you're second guessing yourself, you're not sure what to do. Make sure that you use STOP, the acronym, to help you actually make better decisions and plan ahead of time. Okay. So let's look at sleep. We're just going to have a look very quickly over sleep and settling, because there will be a separate tutorial that you can actually get on more in-depth sleep and settling steps. So how much sleep does your baby actually need? So awake times 0 to 6 weeks, your baby is awake for around about 45 to 60 minutes. For babies over 6 weeks to 3 months, it's 1.5 hours. For 4 to 6 months, it's 1.5 hours to 2 hours. For 6 to 8 months, it's 2 to 3 hours. So down the bottom, I've actually put down how many hours over a 24-hour period that your baby's actually sleeping for. Now, these are real general hours. Remember, every baby is very different. So that's why we actually need to recognise our own baby's cues and being able to sleep. But for me, I think the most important thing is to actually look at the awake times for your baby. So for 0 to 6 weeks, 45 to 60 minutes. Now that actually isn't a very long time, because 45 to 60 minutes, in that time frame from your baby wakes up from one nap and goes down for their next nap, you're feeding, you're nappy changing, you're burping, and you're cuddling your baby in that 45 to 60 minutes. Now, majority of babies go well over that time, and they are actually awake for 2 hours, 3 hours, or even 4 hours. An overtired baby is very, very hard to settle. So make sure that you try and keep in that time frame of 45 to 60 minutes for feeding and nappy changing and burping before they are back in bed. So common challenges when it comes to sleep. Like I said, an overtired baby is very hard to settle. Overstimulation, and this is especially so in the witching hour, between the hours of 4 and 5. And even though we say the witching hour, it's generally not an hour, but often it's related to actually overstimulation or overtiredness around that time of the day. Hunger, not being able to recognise your baby's reflexes, possibly your baby's development, and there again will be a separate tutorial for sleep regressions. Lack of confidence, and definitely overthinking. So let's look at your baby's sleep. Your baby's sleep has actually got 2 different types of sleep. So your baby's sleep is a REM sleep and is also a deep sleep. So rapid eye movement sleep is the light sleep, non-rapid eye movement is the deep sleep. So when your baby is in REM sleep, it's the first sleep phase. Eye movement is present, so there's lots of rolling of eyes. Grunting, startle reflexes be present. Limbs are moving, sucking, increase in breathing rate, and clenched hands. Non-REM sleep, which is deep sleep, is no body movement. There are no noises, there are no startle reflex, no sucking of the hands, and the hands are nice and relaxed and slow breathing rate. So this is a really restorative sleep, and that's probably the most important sleep that your baby will actually get. And majority of babies often don't get this restorative sleep, and this is where the 30-minute nap phenomenon comes from. So how do we create a confident sleeper? So it's all about consistency, making sure they have a full tummy, you have knowledge around their sleep, positive sleep tools, feeling relaxed, positive sleep environment, and definitely comfort. So how we actually settle a baby. So there is a question for you. Does your baby know or recognise the area they are sleeping in? Now, the majority of babies who don't enjoy their sleeping environment, or actually don't recognise their sleeping environment, aren't confident sleepers, is because they're generally falling asleep before they actually are placed into their beds. So here are some steps to confidently settle your baby, especially when you are breastfeeding. Start feeding one side till baby is showing signs of being full, closing eyes, shallow sucks, pulling away, and falling asleep. Sit baby up to burp, making sure baby's back is upright and they are relaxed. A crying baby will not be able to burp well. Keep burping time to a maximum of 5 or 10 minutes. Place baby on the side for optimum place baby on the same side for optimum hind milk after you've actually finished winding and feeding till breast feels empty. Offer the other side if you feel they need it. It is best not to time feeds. Playtime on the floor, nappy change, black and white book, because I love black and white books, especially under 6 weeks of age, and watch for tired signs. Tired signs are crying, jerky movements, arching of the back. Remember, the tired signs, the hunger signs, the wind signs, and the pain signs are all exactly the same. Swaddle bubs or place your baby in a sleeping bag. Cuddle until settled, but awake, and then place in bed awake. Oh, hang on, just get that back. Oh, here we go. So remember the awake times is 0 to 6 weeks, 40 to 60 minutes, inclusive of feeds, winding, playtime until bedtime. Repeat every feed cycle at night, minimize burping, nappy changing, and no playtime. So this scenario is definitely just for during the day. And as far as the helping you more looking into actually resettling, there will definitely be a different tutorial for that as well. So tools we use to help settle babies. Feeding can be one tool, definitely rocking, walking, driving, white noise, swaddles, cuddles, but we definitely love lots of cuddles, pacifiers or dummies, or blackout curtains. Now the challenge with some of these tools is that some of these tools can be positive, but they can also be negative tools. And some of these tools are not sustainable. And can create quite a challenge when you're actually helping your baby settle. So your brain is an association machine. So whatever we do as adults, we associate with actions during the day. So you've got to think as far as with your baby, what am I doing consistently? Is this creating a good outcome, or is creating a challenge for me that is not sustainable? So a thought to ponder. Is the tool you're using sustainable for both you and your baby? If it's not, then you actually need to change it. So this is what I call the habit loop, and I actually use this in my sleep ebook, which you can actually purchase on the website. So the habit loop is like a cycle. You have a cue, you then create a routine around that cue, and that cue becomes a reward. So let's have a look at a crying baby. If you're actually feeding your baby every time they cry, it means that food has now come a comfort rather than a hunger, because you're unable to recognize your baby's cues and you're actually feeding your baby every time they cry, especially when they're snack feeding and feeding very, very frequently. So cravings continue and the habit loop is created. So this is just a very simple way of just giving you some insight as far as how sometimes habits can actually be created even for your babies. Now this is especially so for babies who are over 2 weeks of age. Generally under 2 weeks, it's, you're still sort of getting to know your baby. It's really hard to get your baby into routine because they've just arrived in this big wide world, and they will do a lot of sleeping and will do a lot of feeding. But you can actually start a really good pattern and a really good feeding and sleep routine after the age of around about 2 weeks. So common challenges when it actually comes to a lot of feeding and sleep can actually be reflux and colic, and I'm hearing a lot of babies are being diagnosed with either reflux or colic. So these are often related to feeding and sleep. Minimizing the effect is knowing your baby's cues. So the reason why a lot of babies are actually being diagnosed with colic or reflux because they're either overfeeding and they're not sleeping. Now, I'm not saying that there isn't a thing as such as true reflux, because we can actually dive a little bit more deeper into that, and sometimes it's more of a medical concern as far as reflux. But when we're looking at very simple terms as far as reflux and colic, especially silent reflux, it may be related to your feeding and sleep. So the causes are lack of sleep, definitely overfeeding, and feeding frequently as far as snacking. So to minimize the effects of reflux and colic, consistency with sleep and feeding are the key, and avoid snapping and recognize your baby's cues are the most important. Remember these 2 words, perseverance and consistency. So whatever you persevere with, whatever you are consistent with, is going to create an environment that is either really positive for you and sustainable, or an environment that will give you challenges. So it's up to you to actually decide what you would like to do around those challenges. So I hope this has actually helped. Make sure that you keep an eye out on more feeding and settling tutorials, and also some more in-depth tutorials as far as reflux and colic, and other tutorials that will be on the way. Thank you for listening, and I look forward to seeing you again or helping you again soon.